11 o'clock, so Maura and Ellen, why don't you take it away? Welcome, everybody.
Okay, I'll jump in. Hi, everybody. Thanks so much for being here on this beautiful day. I know it's such a difficult kind of senseless time that we're in. So I appreciate everybody trying to connect. And, you know, hopefully our communication back and forth will help us all get through this. So today I'm so happy to have Ellen, and we're gonna give you both state and federal update this week. And things are not moving quite as fast as they were, you know, a month ago in terms of our state and federal news on COVID. But there are definitely some things to share, and we still always want your feedback and your questions. So, I wanted to start. Just really by addressing the incredible situation we're in with the protests and the death of George Floyd. And the ARC of the United States put out a statement this week. And I encourage everybody to read the full statement, but I put a piece of it here that we all must step up and speak out, including our nation's leaders, to uphold the rights of communities of color to be free from over-policing, police brutality, misconduct, harassment, and racism. To be silent is to be complicit. And, you know, I think this speaks to us really strongly, especially the disability community. And it makes us think also of the intersectionality in our community as well. So we have so much work ahead of us in terms of addressing discrimination and bias. And I hope that we can all really stick together around this. Before we go to the goals for today, I feel like maybe now would be a time to just, if anybody wants to speak up about what's been happening this week and about the protests, go ahead and do it now so it doesn't get lost later. Carrie, is anybody in the chat? Because I'm not looking. Okay, well, feel free to, yeah, go ahead.
Oh, it just, there is a question, and it's not related to this, it's just there's going to be a webinar tomorrow, and there won't be a webinar tomorrow. Okay. This is we're moving on. We're just going to be doing state and federal updates on Thursdays from now on. But I have to say, I really appreciated Peter Burns' statement for the ARC. I think it was so eloquent, and it's, you know, it's such a difficult time that it's really important for all.
When it webinar starts tomorrow?
Oh yeah,
there won't be any more. Yeah.
No more Fridays. You got to join me on Thursdays. Yeah. Ellen and I will be on Thursdays at 11. Okay. All right. So, yeah, I agree, Ellen. The ARC has been so strong. The ARC US has been so strong for us during this COVID crisis, and it was really nice to see them step up around this as well. We really look to them for policy and for change. So it's nice to know we can count on them. So today, I wanted to just quickly review, because if I felt that everyone was feeling really helpless and like there was very little control over what's happening in our world and our government. And I wanted to take just a minute to kind of go over the impact that we've had just during this COVID crisis as a community. And then talk a little bit about our priorities now and the work ahead, a quick State House update and some stats around COVID, and then turn it over to Ellen for her federal update, and then we'll still have time for questions, hopefully. So again, if Carrie, you can keep monitoring if someone has an urgent question, otherwise we'll wait for the end. So of course I had to share, this has been a very emotional week for me, and I always share my story, but this week I wanted to remind you and encourage you to share your stories with the ARC. We need them more than ever. We need to hear what's happening and to turn it into advocacy. And we know stories are the most powerful ways to do that. So you can get your story about what your needs are, what your priorities are, your fears are, and get those to me or Carrie. Is that a good way to do it, Carrie? We can put our emails
Sure.
again.
Yeah.
Okay.
Yeah, I'll put them in the chat box.
Great, perfect. So I just wanted to share that I think some of you know Neil returned to his residential program this week after being home for about 78 days. And, you know, it was kind of all about balancing risks. And, you know, there were risks of him being at home. And I also knew that I was protecting him from the risks of going back. And I would share that, you know, while he was home, his sleep was really, really difficult. And I know how important that is for him. He just couldn't get into a good structure. But one thing we did do is together, pretty much every morning, we watched the sunrise. And I want to say that it really helped me to cope with each day, to really think about sort of balancing the challenges that were coming with the hopes of the new day. And he went back Monday, but every day this week I've been bouncing up to not miss the sunrise. And it's just something for me that helps keep me balanced. I should be a good balancer because I'm a Libra, but it's tough. If you're not a morning person, try the sunset because it helps too. So I wanted to mention something that's coming up a lot in families who have a child home from residential, and this is under 22. There is definitely a conflict arising between the districts and the residential schools around funding. And while the kids were home, some of the districts have been pulling back on partially on the one-to-one funding. So if, for example, Neil had 8 hours a day of a one-to-one, and the district felt that, you know, why were they paying for a one-to-one when he was at home? And there's lots of good reasons why they needed to continue to keep paying to keep the programs whole. And as you know, they're paying 100% for teachers' salaries in regular ed. So this conflict really was getting heated, and now we were hearing that some school districts are sending out letters saying that they don't want to pay for the entire residential piece while the children are at home. So not just one-to-ones, but residential, that they would switch it to day programming. So this is an enormous impact on our residential schools, and more so, it's a huge stressor on families, or both, I guess, equally bad. So something to keep your eye out for if you do have a child home from residential. You may be hearing this, or your school district may be just straight up paying, and that's fantastic. But it's going to be an ongoing issue if there is any resurgence, or if there are families who are less comfortable, you know, bringing their child back. So we'll follow up on this. But the emotional impact is great, and I've heard it from so many families. And now I'm facing it too, the visitation limitations, the worries about the resurgence. And all I can really do right now is rely on Neil's resilience and ours as a family as well. So thanks for letting me share that. So speaking of balance, we have a lot to do, but we have accomplished a lot. And I want to say thank you, because Katerina was able to pull together some statistics from our action alert system. And I just thought this was such a great statistic to share. Over 250 of you who are connected to the ARC have taken action at least 5 to 10 times using the ARC system. And this is huge. This is why we're moving things like the crisis standards of care, and the equitable and hazard pay for direct support professionals, why we're able to get DDS data released when we pull together. And thank you for your feedback through our focus groups, your feedback beyond the ARC. I know there's a lot of focus groups going on, and all of this is going to help us make change and move forward in the most effective way. We also made an impact on federal relief package and the safety net here in Massachusetts. So Ellen will talk a little bit more about how much more work there is to be done, but this is a lot to feel good about as we keep going forward. So as we're going forward, our priorities right now this week are definitely still looking at those visitation guidelines and taking your feedback, because if you didn't see this week, we released sort of a basic recommendation on visitation. And it did sort of mimic, you know, some of the long-term facility guidelines where we were suggesting outside visits with PPE, and your response was great. So what we heard is that that's just absolutely not enough. You know, we need more, and we need to progress further, and we need our eyes on our loved ones for medical reasons, for safety reasons, and you know, a flip side of it is, you know, there's really less DPPC reports right now, and is that just because parents are not seeing our loved ones, we're not able to detect things? So there's a huge safety risk in that way. We want to prevent the COVID, but we want to also keep our loved ones safe from other medical issues that maybe parents and guardians have more insight into, or especially if there's new staff. So we heard your feedback. We're definitely working on them, although we do think that DDS is releasing initial guidelines soon, maybe today or tomorrow. I don't know. Carrie, I don't know if you heard anything today.
No, no, I haven't. But Christine has shared something. Just wondering if they issued the guidance, and just curious about thoughts on why the state's been slower to address group homes at every juncture than they have been with respect to nursing homes. We're smaller numbers, and don't they view our long-term support services as part of the healthcare system?
Absolutely, the main thing we need to get through, and I think that was something that we worked really hard on for the direct support, and to get that increased funding, we had to really advocate that these are our frontline, these are essential workers. So I think they did hear us with you know, the release of the DDS data, which was great, but we need more advocacy to include DDS and our population in general, and all of the legislation that's coming through. And certainly DDS has definitely been slower. So also, I think they're being really careful. I know that COFAR released some data, a little bit of research that showed that our group homes, not that we didn't assume this, but have a much higher rate of contraction of COVID. I think they're being careful, but when they do release today, I don't think we're going to feel like, yay. I think we're going to be like, okay, step one, but we need a lot more. And it relates to the testing issue as well. As you all know, you know, we can only, even the staff that gets tested could test positive just days later. So we need to think more broadly around, you know, how to keep people safe, and how to make sure staff and families are as safe as can be as we move forward with this reopening.
Yeah, Maura, Jesse had a question. Heard that testing can be a problem for some folks because of the invasiveness. Are there any alternatives at this point?
I have heard of an alternative test that doesn't go all the way up into the nasal cavity. I don't know of anyone that's using it. I know, for example, my son has huge sensory issues. And I was really concerned when he was tested last week. That's why I missed last week's webinar. And you know, it's a lot of it's all about the care and the compassion of the person who's doing the test. So I felt like they really prepared Neil, and they made it quick and easy. But in general, I think you're right. There are some people who really, really struggle. So advocating for that, I think, would be on an individual basis. I think the hard thing is that we just need more frequent testing, or we need antibody testing to come to be more trustworthy testing, and, because, you know, we're seeing group homes go from 0 positive to, you know, 5 positive from last week to this week. So definitely an area that still needs a lot of work. And yeah, I don't know if Chris Hubbard knows of how to access any of the non-invasive nasal swab testing, because I know you were worried about your son too.
More, oh, sorry.
Okay.
Putting on my video too. I don't, and I don't, I haven't, I've seen some things on accuracy as well. And I don't know if there's an accuracy difference. I do know the extremely invasive test, a personal experience in my son's group home. The first time, they've gone through 3 rounds now with positives at different times. And the very first one was when the resident who was tested, it was like my son, and moved around so much that the invasive test was inconclusive, because which can happen very easily if you're resisting it, even if you're medicated, to you know, make you a little more comfortable or sedated. So you know, in the absence of that, what they've done in our situation is they've just presumed positive each time. So they just did it, and but the consequence of that is that the staff then goes into not just masks and gloves and cleaning and temperatures, but they also go into goggles and face shields and full gowning for that period of time, which then, you know, obviously requires, you know, it's a big, an incredible thing that the staff does, because that's and they also go through, and they've also extended all the periods. They don't just rely on the short period I shouldn't say short period, but the CDC period of time to assume that the virus is still present. They've gone beyond that in terms of numbers of days before the house is cleared, and then they deep clean the house. And so they, you know, that the alternative in my son's agency case is to treat anybody who's in the same house who can't be with a positive staff or a positive resident, to assume they're all positive, and then proceed accordingly with the full-blown thing, which to me is a very reasonable strategy. But it does put a premium on, I mean, it's a big ask of staff, because I don't think any of us realize what it's like to do an 8 or 12-hour shift in full PPE unless we work in, you know, healthcare in a hospital. But it also puts a premium on their having adequate supplies, and, you know, I think adequate supplies that will last now for not just a few weeks, but months or years. And so that's, I guess, I feel like I sort of beat a drum every time, but I think I find it a little frustrating that given, you know, our folks' needs, issues around testing, but that's not the only thing, but in terms of their ability to wear masks, even with very elaborate, you know, ABA or whatever design programs to get people used to wearing a mask, that's not going to happen for some of our folks ever effectively. And so, you know, so you have to figure out workarounds. And you know, and I guess apropos my prior comment of, I just, I understand the need to go slow. I also think, though, you get to a certain point and you figure you just have to apply. I'm saying you, but I really wish there was a way to sort of get a sense that these issues are being I shouldn't say thought about, but that they're, you know, that everybody is really focused on ways you can solve these problems, because it isn't a solution to say we're just not going to have visitations for another couple of months. I mean, I know nursing home visits are different. On the other hand, it's harder. I would assume it's harder to take nursing home visits outdoors than it is with the young, you know, at least some of the younger folks in group homes. You know, there's all the social distancing. It's really tough. I'm sorry, I'm rambling.
No, it's okay. Yeah, I mean, and it should be more individualized. They should be able to say, hey, this one person in our group home is really going to struggle with the test. Or, hey, that test didn't look like it went perfectly, so maybe we disregard that, try again, you know, really make it more individualized. And that's what we're, yeah.
And I think, I mean, I have to say, that's what the approach my son's agency has taken. And, you know, so that means some of the really positive developments, like having the Fallon ambulance come and do the testing, that doesn't always work, because the lead time for when you know they're coming, for example, doesn't give enough time for a heavy duty dose of Ativan to kick in, for example, if you're going to have to sedate. So it's, and I think sometimes there's a sense of, well, anybody, even from providers, I've heard on various discussions saying, well, it's not like they really need to be heavily sedated, or, you know, just a little take the edge off. That's not, you know, that's sort of, again, looking at the population of people who are served in group homes as being more homogeneous than they really are. And so I think you're absolutely right that it is an individual, the need for an individual plan, but I don't think that means that one can't develop a good plan that it takes that approach. So
Exactly. Yeah. Thank you, Chris.
So, yeah, we have Maura, we have a couple of other questions.
Yep.
I don't know if we want to take these now. Let's see. When Christine was wondering about the visitation guidelines, are they only applying to residential schools or just group homes?
Right now, we're waiting for the group homes over 22 guidance to come out. I'm actually not sure when the under 22 DESI visitation guidelines will surface, but what probably right after, well, hopefully. But right now, we're expecting the group homes over 22.
Okay, and then Karen's, you know, just a concern that, you know, her son's been with her the entire time. He's age 30, and will he even have a group home to go back with, and will it be funded?
Yeah, so I mean, what I brought up at the beginning, that's a totally different situation with DESI and out of district placements. I know the adult facilities are, you know, they're counting on the state to keep them whole, and you know, being able to bill for day program services right now. And, you know, so far we haven't heard of any closures.
Okay. And Beth also shared a link with the less invasive test from Abbott.
Thank you.
You know, yeah, it's not known to be very accurate. So, okay.
Well, that's right. Again, the balance thing, right? So you're balancing so much. Okay, I'm gonna move on. Right. We are, just so you know, we are speaking with DDS every week, and Mass Health pretty much bi-weekly. We're still looking for more focus groups, and we're hoping to bring DDS and Mass Health leadership into our focus groups or our webinars in the coming weeks. So that's good news, because you guys will all be able to have some direct questions, hopefully to the commissioner and to others from Mass Health. So stay tuned for that. And I'll just quickly zip through an update from Beacon Hill. It's not reopening that we've heard of in the near future, although what is coming up is the budget, and we really do need to focus on that. We're worried about what's going to be able to be maintained. And we see it as, you know, our budget for DDS, if anything, needs to be increased, as well as Mass Health. So it's scary to think of the fact that we may see some cuts. And we do know that tax revenue has been way down this past month, 2.25 billion. And we also know that, you know, they did pass the bill to borrow $3 billion from ourselves, basically, based on the fact that our taxes were delayed. So they are taking action. There's bills moving through the House and the Senate every day. They are encouraging you to meet with them through Zoom, either the legislators or staff. Most of the legislators have signups. So if you contact their office and you really want to kind of figure out what's happening with your state legislator, go ahead and set up a meeting. Tell them what's going on. Tell them your concerns. And then they had some data around the nursing home audit that 49 out of 230 had failed to meet the core measures. And still, as you guys know, they're open now, I think as of yesterday, for open outdoor visits. And then just some interesting COVID stats. We are now below 6% of those tested being coming out positive, which is down 27%, which is significant. Of the 97, almost 98,000 people that tested positive, 80% are considered recovered at this time, and 7% have died. So we have about 12,000 positive active cases right now. The good news in the hospital side is it's down by half since mid-April. And like I had mentioned before, we are seeing a higher rate. The rate in our typical population is closer to 9, goes anywhere between 6 and 9%. And our group homes are higher at 18. So, so then I'm jumping right into the COVID. So I don't know if anyone has questions on any of the state updates. We can.
Yes, Dennis had a question. Why isn't the disparity in pay between the community and residential schools an ADA issue?
The community and residential schools. Sorry, can you explain that a little bit more? Because we know we had a pay disparity between the state-operated facilities and the community-based, which we took care of about a month ago with advocacy. But I might not know what you're referring to.
Yeah, Dennis, do you want to unmute yourself? Okay.
And I can look into that too a little bit more, but you know, our big push was to make sure there was equity and even hazard pay for our community-based providers. But okay, yep. So if any other questions, then we'll move on to Ellen.
Beth had a question if there's more recent DDS numbers out, re-COVID cases and deaths in group homes.
I believe
so they yeah.
Yeah, I think they come out
on one put out today. Yeah.
Yeah, I was just gonna say I think there was something out today because the last I have is the number of 75 deaths, and I forget the exact number of cases now, but if you look at the dashboard, it'll be there today or tomorrow.
All right.
Yeah.
I think we can move on to Ellen.
And Ellen, I can move the screens for you.
Oh, great. Thanks so much, Maura. And so as we mentioned earlier, we will not have the federal update tomorrow. From now on, we're just going to be combining the state and federal updates on Thursdays 11, and then we expanded it to 45 minutes. And we just feel like as Maura explained, it made sense. We had some overlap and questions about state and federal advocacy and policy, so it made sense to combine, and things have slowed down a bit. Also, to be fully transparent, I'm 36 weeks pregnant and will be going on maternity leave soon, so inevitably we had to kind of shift things a bit. So so we will not have one tomorrow, from now on. But so let's, and I'm not sure how much overlap there is as far as who's attending the federal update calls, but I just wanted to reiterate that there is that fourth COVID-19 stimulus package. Some call it the fifth. It's, a little confusing sometimes, but it's called the HEROES Act, and it passed the House on May 15th, and it's still pending in the Senate. And it's a really comprehensive bill, and we're very, very supportive of it. It has a ton of provisions. It's over $3 trillion in stimulus funds. And it establishes a $200 billion HEROES fund for essential workers and $75 billion for coronavirus testing. And there's $1 trillion that goes directly to state, local, and territorial and tribal governments. So, and I also wanted to point out that it's extremely meaningful to communities of color, which have been disproportionately impacted by COVID-19 as the disability community. So I just wanted to point that out as we move forward and push for our advocacy, that our communities should be advocating together on this really important legislation. For the priorities for the disability community, I just wanted to highlight them again. I've mentioned them before. The big one is the dedicated funding for Medicaid home and community-based services. So these funds are just so crucial for people with disabilities to keep them in their homes and their communities. And it also provides better wages and support for the direct support workforce. And it also includes, we're hoping, this is all in the House version of the bill, and we just want the Senate to keep it in their, when they're working on their portion of the bill. And I think we expect things to change, so that means it'll go back to the House to revisit everything. So the next is personal protective equipment, PPE, for direct support professionals. As we know, we've talked about this many times, it's so important and crucial to protect the health and safety of our workforce. And DSPs must be designated as essential workers across the U.S. so that they can get access to PPE and medical supplies. In addition, paid leave for all caregivers. We know it's not just parent caregivers that support people with disabilities. Families have lost their usual sources of care, and we just want to make sure that all family caregivers have access to paid leave and sick days to help their loved ones. And then lastly is the economic impact payments for all people with disabilities. So we want to make sure that the stimulus payments are available to everyone, including adults with disabilities who are claimed as dependents on someone else's tax returns. So, and I've mentioned this before, we've got our WeAreEssential campaign from the ARC of US is leading it. We keep using the stories, as Maura mentioned earlier, that we're always collecting stories at the state level. But that's true also when we're looking to lobby Congress and advocate to our senators and our representatives. We need to share our stories as well. And this is a story collection tool that the ARC of US has established, and it's really easy to use, but it's so crucial for any of our advocacy. And then we provide a link every week to these sample tweets and messages for the WeAreEssential campaign. And to continue, we're at the point where we really need to pressure Senate and keep the HEROES Act, important in their minds, and make sure that they're continuing to hear from us. So please use the action alert that the ARC of US has provided to call, email, and tweet to your senators, and spread the word to your family members in other states as well. So we wanted to let you know about the Massachusetts Supplemental Nutrition Assistance Program, SNAP, now has an online purchasing program. So as of May 29th, all Massachusetts residents who receive SNAP benefits can use their EBT card to buy food online from Amazon and Walmart. So these are SNAP authorized foods that are designated on those websites. And unfortunately, the SNAP benefits can't be used to pay delivery or shipping fees. But this is a great step forward. I know this was, particularly useful during this epidemic. So we're really excited that this is happening. And then next, which I've I had on last week for the federal update, I just wanted to remind everyone that the CDC released COVID-19 guidance for individuals with disabilities, and they have different sets of guidance. It's a little confusing, but if you go to that main link, you can distinguish between the different forms of guidance. But I think it's important as we move forward in Massachusetts that we're looking at what the CDC guidance says and what our state needs as well. And so we have some template of what we're doing in Massachusetts. And then lastly is the census. Just remind everyone of how important the census is for our community. Our self-response rate is 62.7%. We're still ranked 20th in the U.S. The ARC of Mass is working really closely with our state count committee to continue to get the word out to all hard to count populations, including the disability community. We have a day of action coming up on June 17th, so we'll let you know as it gets closer. We have some sample tweets and social media things. We also will be doing some text banking and phone banking, so we'll let you know about those opportunities as they come up. We're also a Census Questionnaire Assistance Center, and just our new contact information. I've had it up for the past 2 slides. I just want to let you know that we have a new number to call if you have questions about the census. And then, of course, we have our webpage for any information. And we've got some good fact sheets about the census, so definitely check it out if you haven't already.
All right, thanks, Ellen. There is a question. Can you put the CDC link in chat? And everybody will get a copy of the PowerPoint slides as well, and the link will be there as well. But if you could wouldn't mind putting it in the chat box, that'd be great.
Great. And
Maura, would you mind?
Yeah. Yeah, let me stop sharing my screen so I can do that. And let's say this is just checking our webpage, and as Ellen said, we're continuing with our Monday webinars. Now we'll have Thursdays together, and Carrie is continuing her Tuesdays at 11. So you can all stay with us. And I just wanted to share, as always, a little verbiage that says mines are like parachutes. They only function when open. And I feel like as we move forward, we all need to be really open-minded about how things are going to look, really flexible around how we all move forward together. And I wanted to also just mention, I meant to say this during a state update, that even though legislation on a state level is really pretty much come to a halt unless it is a COVID bill, we are working still on our bill platform to try to figure out which bills may possibly be able to be combined with a COVID legislation. Some of our bills actually really dovetail into current COVID legislation. So we haven't given up on our platform, and you may see some things come out from us around contacting your legislator to get some of these things through. And there are also some legislators who feel, regardless of the priorities of COVID, that they're still going to push for some legislation, and we may also get an extension on the July deadline. So that's just a pretext for that. But any other chats in here for us?
Maura, can you hear me? It's Nan.
Hi, Nan.
Hi, on that topic of legislation, as you know, we emailed about this, but I'm eager to see the mass health coverage for ABA for adults to be attached to a COVID bill, because had we treated ABA as a medically necessary service, it could have continued for the adults who need ABA, and just as it did for the children who ABA was able to continue during the quarantine. So if we are able to have mass health start to recognize that ABA is a medically necessary treatment if we have to go into another quarantine. Many of the adults who have suffered from self-injury and aggression during this period would be spared that next time.
Yeah, I agree. And I think as we saw, it took a bit for the ABA people to kind of get up and running during the beginning of this crisis. But in the, as we all got used to more telehealth services, and for those who absolutely needed in-home support, it was available under 22 for Mass Health. So yeah, I'm actually meeting with Christine Barber tomorrow over Zoom, and that's definitely on the list of priority bills to figure out, is there a place where we could connect it? The issue really is that all the COVID legislation that is going through, the main goal is to not slow any of this legislation down once it gets to the House or the Senate. So most of the bills that we could attach would have to be really no issues, and really make sense to push through. And what I do think is that Rep. Barber has a lot of capital and is willing to step up for the disability community. So we're going to throw a bunch of bills at her, see which ones she thinks are possible, and work with our other legislators as well.
Okay, I think the ABA bill would do the most to protect the most severely affected people with developmental disabilities. So I'd love to see them prioritized for once.
I agree.
Okay, thank you, Maura.
Any other questions?
None in the chat box. Karen, thanks. So thank you so much for all these sessions. They are so informative and helpful. Thanks for the feedback, Karen.
Well, thanks everyone. I think we ended right at about 45 minutes, so I really appreciate your time, and actually all the info that people have put in the chat. Ooh, I did not put the link in the chat, so let me do that right now.
And Ellen, good luck, says Christine.
Thank you, Christine. I just want to mention, we didn't talk about this, but the House and Senate did pass the Paycheck Protection Program Flexibility Act yesterday. When it already passed the House and then it passed in the Senate, which just gives nonprofits more flexibility with their loans that they receive to keep their organizations going during COVID-19. So it's a good step, for Senate to be moving forward on this bill, but obviously we're very anxious for them to move on the HEROES Act. But I just wanted to let people know in case they didn't hear about the PPP Act.
Great.
Sorry, I'm slow on my, hold on, I'm almost there. It's the CDC link.
And you could just Google CDC, guidance.
There it is.
It's in there.
I'll give people a minute to copy and paste, and then I think we're good to go.
Yeah, so everyone have a great day and stay safe. Let's all pray for no resurgence, and I hope to see everybody next Thursday.
Thank you.
We'll talk, Jesse.
Thank you. Thanks. Thanks, Maura.
Thank you.
Should I stay on?
Ellen, do you have a minute to stay on?
Sure. Yeah.
That'd be great.